Hi, Teresa. Thank you so much for joining us today. I'm so excited to have you here. Everybody, this is Teresa from Home Care Assistance. Tell us about yourself.
Hi, thanks, Rashida. My name is Teresa McLeese. I'm a registered nurse and a certified senior advisor. I've worked in the home care segment of healthcare for about 10 years now. And I started my journey in healthcare because of my grandfather. What more appropriate month than right now to talk about my grandfather? He suffered from Parkinson's disease.
Oh, wow.
And as we celebrate, it's Parkinson's Awareness Month, it really reminds me why I joined home care 10 years ago.
Wow. So Teresa, thank you so much again for sharing your story with us about your grandfather. It's really awesome to know that that's like why you got into home health care and nursing. I have a little bit of a family story myself, but I thought it was really fitting for our conversation to be happening today as the governor of Virginia and other governors were just giving their kind of recap or state of what's going on right now, and talking about the fact that people have been reaching out and asking how can they bring their loved ones home, especially from facilities that are having so many challenges taking care of people. And that's been right on the pulse of what we've been talking about, because I know that I've had clients reaching out that have been concerned about how to prepare for their loved ones coming home, or how they can find new housing for them, what can be done so that they're in a safer environment if the facility cannot handle it. Not all facilities are in such disarray, but it is a big issue right now. So tell us about your company and your services, and just some tips on how we can prepare for that.
Absolutely. As you know, home is the safest place for people to be right now. Not only is it the safest, the social isolation and the impact of the daughter that can't visit mom that's visited her every single day. More and more the grandchildren that are home from school and getting the impact of social isolation. So not only is it the safest place, but it's also helping on the emotional aspect too. But when you go home, you need to supplement the care that you had in the community. And those services come with multiple. I'm just actually a little piece of that whole entire care team. Right. But it is possible, and we are ready to do it. What we're working on is a professional advisory council, and we meet. It consists of house call doctor, telehealth medicine, pharmacies that deliver, and then also home health services if skilled nursing is needed. So for home care specific, we do at Home Care Assistance, we are strictly private duty. So bathing, dressing, hygiene, those are called activities of daily living, helping you prevent falls when you get home, helping you do range of motion to stay strong and to prevent atrophy. We also do instrumental activities of daily living. So think of your grocery shopping, which, wow, how nice is that, right?
Absolutely.
At the grocery store. Going to get medications, bill paying and banking, setting up video chats, and companionship and activities. Home care assistance is really focused on two methods, and they're proprietary to our company, and they're the cognitive therapeutics, so brain stimulation, and also the balanced care method, which goes back to my grandfather and why I was so excited to return home, as I say, when I took this position 7 months ago with Home Care Assistance, because they focus on mind, body, and spirit. Right. And that's so important that, you know, often when we call and we need care at home, we're asking for just, I want meal preparation. Okay, anybody can make a sandwich. Yeah. But what we need to do is give you those blueberries that are going to promote your brain health throughout the day. We need to give you the right amount of protein. And then we, you know, just a routine that keeps in mind, body, spirit.
That's awesome. So it's, I thought that was such an important tip when you mentioned those things, because I've had family members who have actually been home healthcare aides or nurses. And I remember my aunt in particular, my aunt Lucita, she would get phone calls from one of the ladies that she was taking care of because she was her primary care person. And she would call her and, you know, she'd be like, I gotta talk to my lady right now. Give me a few minutes. And I just thought like, wow, look at that dynamic in that relationship. So when I met you and we were talking about that, I'm like, I can understand and see how important that is. And especially like in today's world, having someone to go to the grocery store for you and know how to properly sanitize to re-enter the home, to be around our most vulnerable population, that's important.
Absolutely. And I'm glad you bring that up, because I had a client recently, and what we're doing at Home Care Assistance, we're really looking at caregiver mapping and minimizing, you know, the spread. And so caregiver mapping, what that means is if somebody works in a communal setting, taking a look at that and trying to dedicate them to one client in one community.
Those are all great points. So I know you're super busy because like you have so much going on. So I'm just going to ask you one other question before we close this out. And are there any tips for anyone that, let's say they can't get to you now, or they're still like in the middle of this whole process? Are there any safety tips that we can all have for maybe our loved ones or just anyone in a vulnerable population, not necessarily just geriatrics, but we're kind of all vulnerable at this point, but you know what I mean? Any safety tips or anything you want to offer to the public?
Absolutely. You know, practice social distancing.
Yeah.
Follow CDC, proper cough and sneeze etiquette. Don't go to work or don't go to the grocery store. Don't go to CVS. That one item does not matter if you are not feeling good.
Yeah.
I think right now it is protecting ourselves and also protecting the greater community by decreasing the spread.
Absolutely.
When you do go out to the grocery store or you do have to go and get something, maximize your visits.
Okay.
You know, if you can buy a 2-week supply versus what you normally only do 3 days at a time, just maximize what you get so that it prevents you to have to go out again sooner.
Absolutely. Okay. That sounds awesome. So thanks again so much, Teresa. We really appreciate you giving us some of your time. I know that that's really valuable, especially as you are an essential worker and you are out there on the front lines helping, you know, your caregivers take care of people right now. So thanks for that time. Awesome. Well, we will check in with you later.
Thank you.
Bye. Have a good day.
Be safe.
You too. Bye.